Welcome to the On-Call MultiPro tutorial series. This video addresses patient and control testing for the On-Call MultiPro. The testing procedure is very simple and straightforward. This step-by-step instructional will help enable you to start running tests within minutes. It is recommended that you review the On-Call MultiPro sample collection and sample prep tutorial prior to viewing this video. Be sure to bring samples and test cartridges to room temperature for approximately 1 hour before testing if kept in cold storage. Test materials must be between 15 and 32 degrees Celsius prior to use. Collect the patient sample and load it into the test cartridge as demonstrated in the On-Call MultiPro sample collection and sample prep tutorial video. To start, click the Test button on the home screen. Next, enter the patient ID, patient name, and sample ID on the screen before inserting the test cartridge. This can be done either manually or with the optional barcode reader. Open the cartridge compartment cover of the analyzer and insert the test cartridge containing the patient sample into the cartridge compartment with the label facing left. Avoid touching the circular optical window of the test cartridge. Be sure to insert the test cartridge vertically and slowly. Push the test cartridge completely to the bottom of the cartridge compartment. Closing the cover will start the test automatically. The test results will be displayed on the screen after testing is completed. Do not open the cover during testing. If the test button is not clicked before the cover is closed, the analyzer will not start the test. Should this occur, open and then close the cover to begin testing. To remove the test cartridge, open the cover and remove the used test cartridge by gently pushing the tab on the top of the cartridge to the right. Close the cover once the cartridge is removed. The standard controls must be reconstituted after first opening the kit. They will remain stable for 3 months when stored at 2 to 8 degrees Celsius. To begin, reconstitute the controls according to the package insert, or remove the prepared control solution from cold storage. Be sure to bring the control solution and test cartridge if kept in cold storage to room temperature for at least 1 hour before running a control test. Remove the capillary device from a new test cartridge. Unscrew the dropper cap of the reconstituted control solution. While applying only slight pressure to the bulb, insert the tip of the dropper into the control solution. Tilt the bottle as necessary. Release pressure on the bulb to aspirate a very small amount of control solution. Use the capillary device to absorb the control solution collected in the dropper and completely fill the capillary tube. Do not touch the dropper to any other surfaces. Squeeze any excess control solution out of the dropper back into the control solution bottle. Insert the capillary device into the test cartridge vertically and slowly. Avoid scratching the inner wall of the cartridge with the capillary tip. Again, be sure to avoid touching the circular optical window of the test cartridge. To initiate a QC test, click the QC test on the home screen. Insert the Control ID cartridge with the label facing left and close the cover. The analyzer will read the cartridge automatically. After the cartridge has been read, select Control Level 1 or 2 on the screen and click the green checkmark button to confirm. Open the cartridge compartment cover of the analyzer and remove the Control ID cartridge. Insert the test cartridge containing the control into the cartridge compartment with the label facing left. Be sure to push the cartridge completely to the bottom of the cartridge compartment. To start the QC test, close the cover and click the Test button on the screen. The control test results will be displayed on the screen after testing is completed. Remember, do not open the cover during testing. To remove the cartridge, open the cover and remove the used test cartridge by gently pushing the tab on the top of the cartridge to the right. Close the cover once it's removed. This concludes the On-Call MultiPro patient and control testing tutorial. The next part of this video series will review maintenance for the On-Call MultiPro.